We now know that everything and anything has its own unique electrical signature. And as a result, everything and anything can be examined on an electrical level. So when you come to the office, we're going to examine you to find any hidden traumas that may be at the root of your condition.
At Gooing Chiropractic Clinic, we use QRA, NET, chiropractic, and the Zirconia cold laser to locate and correct the hidden traumas that are at the root of your symptoms and loss of health. With muscle testing, Gooing Chiropractic Clinic uses the concepts of electrical physics to locate specific areas of trauma in the body. By doing this, we are looking at your body as an electrical field. As previously mentioned, the body is an electrical entity, and trauma can disrupt the flow of electricity throughout the body. Muscle testing allows us to examine every nerve and organ in your body, just like an electrician would examine your electrical circuits for shorts. First, the patient's position on the table, and then using a leg, arm, or hand, the patient is tested by the doctor to see if the patient is strong enough to lock out the muscles in the test extremity to the point that they can resist a manual force exerted by the doctor without the extremity failing or collapsing under pressure. Many times, patients are so ill or traumatized that they don't have the strength in their body to hold a lock of an extremity. In this case, we will use an assistant to help test. The assistant will place one hand on the patient, and the patient will be tested through the upper extremity of the assistant. We are using the assistant as an electrical conductor. Because of this, the doctor and the assistant have to be cleared electrically so that they can reflect the patient's true electrical energy. Muscle testing allows us to ask your brain yes or no questions. Testing a trauma site will trigger the brain to replicate the physiology that occurred at the time of the event, and the muscle test will go weak, with or without an assistant. The brain will also record the date of the traumas, and we can find out when the original traumas occurred. Muscle testing is highly interactive and allows us to test the patient beyond their perception. When we begin testing, we are looking for short circuits in the organ meridian system and spinal system. When we find a short circuit, the brain replicates the physiology that occurred at the trauma site, and the muscle test goes weak. The body is mapped out like a circuit board with reflex point for all main meridian points and all the spinal nerves. These systems are interlinked. When we start testing, we are looking for reflex points that, when tested, will blow the electrical circuits being contacted. This tells us the point of trauma, and for us to continue testing with QRA. Since the body generates an electrical impulse of 635 nanometers, we can use the Zirconia cold laser, which emits the same electrical impulse as the body, to examine you on a molecular or DNA level. This helps the doctor identify and eliminate those frequently hidden inducers and promoters of illness. We can identify the cause of your trauma and the cause of your condition. We also take a look at your x-rays to measure the effects of traumas on your spine. The organs will show their dysfunction on a spinal level that is measurable. We use x-rays to evaluate your genetic potential relative to your symptoms and conditions. Sometimes, the patients will come in with symptoms of a 65-year-old, but when we look at the x-rays, we discover that they have incredible genetic potential. Their spine is actually younger than their age, but they have symptoms of someone who's very ill and 65 years old, which is not congruent. So, there has to be something disconnecting their brain from their body, causing their body not to express its full genetic potential. Once we have all this information, we'll be able to put together a treatment program that's right for you.